Hello, people. Today we have a super interesting podcast about Desacondition syndrome in people. For that, we have three physiotherapists from Manuela Beltrán University. With you today, Nicolás Villamil, Vanessa Rey, and Sebastián Villarraga. That's right. Today we will tell you a little about the Desacondition syndrome in people. To begin, with this syndrome is a metabolic and systematic deterioration of the organism as a consequence of prolonged immobilization. This can be seen in the first 24 hours of immobilization, but in a few words and easier, this syndrome refers to the loss of strength, endurance, and physical function due to lack of activity or regular exercise. This usually occurs because the people enter intensive care, surgery, are hospitalized, or maybe the people are very sedentary. This also has the objective in terms of anatomical condition to be aware of weight, body proportions, height, and different evaluations. In terms of physical condition, be aware of cardiovascular and respiratory function, and among others. In terms of motor condition, be attentive and improve strength, balance, coordination, skills, and abilities. That is very important. But other important thing is to look at the patient's condition signs if they be influenced by factors such as age, pathology, duration of rest, or the severity of the injury, and review the ABCDEF of intensive care is a very important in this intervention. Sign the syndrome is a multi-system condition, so all systems are going to have problem, which my friend Vanessa is going to tell you about below.
I am Vanessa Rey. Will talk to you about the clinical manifestations. Nervous system in coordination leads to this to the events, loss of memory, tendency to pressure and depre, sensory depreciation, neurophage, do and trifers, patient and neuropathy. Pulmonary system of all lung volumes and capacity, stance, deterioration of functional residual capacity, production and distribution of sulfate, gastric infiltrate of peristalsis, effective intestinal absorption, malnutrition. A genitourinary system urinary stasis, incontinences, y 1 urinary infections. Metabolism nutrition 1 nitrogen excess, 1 calcium extraction, phosphorus extraction. Muscular system. Muscular weight creation reduces tolerance to exercise, insulin resistance, glucose use, alteration of proportion, balance, coordination, plague and paribus. Skeletal system. Osteoporosis unif low, bone fibros and ankylosis. Cardiac system. One feeling pressures, a one introthoracic flow volume, viscosity, heart rate, cardiac muscle atrophy, ejection volume, high function or orthostasis. Tegumentary system. Preston ulcers, bursitis, edema.
Role of the physiotherapist. Among these, the impact of early mobilization protocols and the training of aerobic capacity, strength, muscular endurance, and independent motor activities stands out. In addition to it positioning and respiratory physiotherapy techniques, since this exercise helps to improve the capacity and functionality of patients, restore their physical independence, specifically in patients who are difficult to wean ventilatory. It is suggested to perform 2 sessions a day, 7 days a week in session of no more than 10 minutes, with permanent monitoring of clinical signs. Since with this exercise it is possible to increase the ranks on joint mobility, prevent muscle weakness, or improve the strength and endurance of the core and limb muscles, which finally participates in the functional process of the ventilatory pump and allow stabilization and postural control, in addition to achieving an impact on the cardiovascular and pulmonary system. Since an adequate venous return is simulated, increasing preload, afterload, cardiac contractility, left ventricular ejection fraction, optimize oxidase process, it favors the prevention of atelectasis, decrease the accumulation of secretions from the airway, which implies an acceleration for ventilatory weaning, a prompt functional recovery, and a rapid return to daily activities. The use of cycle ergometers and submaximal exercise have an impact on the training of the muscles of the upper and lower extremities, as it facilitates muscle recruitment, promotes joint mobility, and facilitates functional movements, which allows improving or maintaining